As New York and New Jersey race to get vaccinated and return to life as we knew it, there are still many questions and concerns about coronavirus, its spread, and the big question, how to stop it. Who better to answer them than the leading authority in the fight against COVID? Joining me now is the director of National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci. Dr. Fauci, welcome to the Pigskin Morning News. Happy to have you here.
Good to be here. Thank you for asking me.
So, Dr. Fauci, we're about 3 weeks post-holiday, right? More than 15,000 new cases in New York yesterday, more than 4,000 in New Jersey. So is this the post-holiday surge that we've heard you talk about, or can we expect it to get worse?
Well, it could conceivably get worse. We hope not, that if individuals adhere uniformly, not in a spotty way, but uniformly to the public health measures that we talk about, the uniform wearing of masks, avoiding congregate settings, indoor people congregating, keeping one's distance. I mean, obviously, they sound very simple given the enormity of the problem, but we know that it does work, that when these public health measures have been implemented consistently, that you can get control of the surge. It's very difficult to predict. You could model how much worse it's going to get. I hope that we've seen the full brunt of the increase blip, as we called it. It's not a blip, it's very serious, but an increase in the surge that generally follows travel and people congregating together. We see that after events, whether they be the 4th of July, Memorial Day, Thanksgiving.
Right.
So right now, if you time it, being in the middle or close to the middle of January, we very likely are seeing the full brunt of the travel as well as the social gatherings that generally take place with family and friends over the holidays. So I think we're probably right in the middle of that right now.
And you know, people are starting to let their guard down because they're hearing all this talks of the vaccine, right? So the rollout of the vaccine, it has been widely criticized. As of Monday, 22 million doses distributed, 8 million actually administered. That leaves around 14 million sitting in freezers. Does the speed of the rollout concern you at this point?
Well, I mean, obviously, we need to do better. No excuses there. We can't just say, oh, that's nothing. It is important that we haven't reached the goals, but I think there are some reasons for that, not excuses, but reasons. And one of them is that the beginning of an enormous endeavor of trying to get the entire country or a vast majority of the country vaccinated will always have bumps in the road and hiccups. And also, it was started right in the middle of the holiday season between Christmas and New Year's. So we would hope that over the next couple of weeks, we're going to see an acceleration of that. Also, in addition, I believe, and I think everyone agrees now, that in an attempt to do it in an orderly fashion with phasing it in, first phase, healthcare providers, people in nursing homes, and then 1B, people over 75, and people in, I think that has, you know, inadvertently and somewhat paradoxically caused a restriction in the freedom of just getting the doses out there. So what you're going to be seeing in the next couple of weeks is a greater degree of flexibility in getting to people who are older than 65 or younger than 65, but also have underlying conditions. So let's hope that loosens up and we have an acceleration of the implementation of the vaccine.
And that brings me...
You're right.
No, go ahead. Yeah, that brings me to what the CDC announced, right? All people 65 and older now eligible. So Governor Cuomo is saying that he would follow the guidelines, but he was saying yesterday that there's just not enough vaccine if you expedite the process. So how do you move quicker but without causing chaos?
I mean, you know, you just put your finger right on it. There has to be a delicate balance because the guidelines themselves, and the CDC director said that yesterday, that those guidelines were never meant to restrict people's ability to get vaccine out there. That's true. But if you open up these guidelines and give greater flexibility, that has to be matched by the supply of vaccine, which is obviously in limited supply. So you really have to have a delicate balance of being flexible enough not to restrict the application or the administration of vaccines at the same time as not opening up the floodgates, as it were, and when you have more people who need to get vaccinated with long lines. So you've got to figure out a way how to do that in an orderly fashion.
So President-elect Biden, and let me go to that because he says he wants to administer 100 million doses of the vaccine in 100 days. Are you looking at that as maybe too ambitious? Is it doable?
No, I think that's doable. And if you map out they call it a cadence of how vaccines come online from the factory into the transport, into the local place. If you look at the proposed cadence that we have for that 1 million per day or 100 million over 100 days is eminently doable. I mean, if it's organized right, we can do that. I was going to say I'm confident that we can do it. The question is, will we do it? So that just really remains to be seen. But it is absolutely doable.
And there's so many talks about getting that second shot, right, and scheduling that second dose, and that seems to be a concern, right? So if you get just one, are you protected?
You are partially protected, and we don't know for how long you're protected. The clinical studies of both the Moderna product and the Pfizer product is that optimal protection is you can get some protection after the first dose, but with Moderna, 28 days later, you get a boost, and somewhere between 10 and 14 days after the boost, you have maximal protection, and it's reasonably durable. If you only give one dose, you're getting suboptimal protection,
right,
and we don't know how long it lasts. And that's the reason why we want to make sure that people don't get confused, that no one is saying not giving the second dose.
Right.
The second dose is very important to the kind of protection that we know that you get from the clinical trial.
And if you are vaccinated, right, can you still be a carrier of the virus?
Yeah. Yes, it is possible. We don't know for sure, but the endpoint or the primary endpoint of the trial would be whether or not you get clinically recognizable disease. So the 94 to 95% efficacy was efficacy against clinically symptomatic disease. It was not against whether you're infected or not. So it is conceivable, though we need to learn more about it, that you could be protected from getting sick, but still carry the virus in your nasopharynx, which means theoretically you could infect someone else, which is the reason why you've heard me and my colleagues saying that even though you've been vaccinated, that does not mean you could forget about wearing a mask.
Exactly.
You still got to wear a mask.
Such important information there. You know, Dr. Fauci, so many moms right now are watching here in the New York area. They want to know, when will their children be eligible for vaccines? Do they even need to be vaccinated here?
Yes, ultimately you want to vaccinate all vulnerable people. The reason that children are not getting vaccinated now is that historically, whenever you're introducing a new vaccine, there are vulnerable people. Children are vulnerable, pregnant women are vulnerable. So you want to show that your vaccine product is both safe and effective in a normal adult population before you go to the vulnerables, and those are children. So right now, sometime likely before the end of January, beginning of February, we're going to be starting trials in younger individuals, first adolescents and then down to children, so that we will then, within a period of a few months, be able to say we know that it is safe and almost certainly effective in children and then ultimately in pregnant women.
Understood. And with all this talk about vaccines, there's this other talk about mutations, right? We know the UK variant here in the US. There's also this mutation found in South Africa, 12 other countries. So what is your biggest concern when you look at these mutations? Because we don't want to cause panic and alarm, but there has to be a concern here as the rollout of the vaccine is also underway.
Well, we're looking at that extremely carefully and intensively. We know from our British colleagues who are now dealing with this in real time, because that's the dominant mutation, is this particular mutation in the UK. They have found that it's associated with an increase in transmissibility. It does not appear, according to them, to have any effect on what we call virulence, namely on a case-by-case basis. Does it make people more sick or more likely to die? That doesn't seem to be the case. And they're saying it's not interfering with the protection that's afforded by the vaccine. That's something that we ourselves are looking at very, very carefully. It is likely that the South African mutation might be more problematic because it appears that that might be evading some of the protection or treatment that you get from monoclonal antibodies. Whether or not it's going to ultimately impact the vaccine, we don't know. To be sure, we're taking it seriously and following it. And if we have to make adjustments in the vaccine, which we don't have to do right now, but if we have to do that, then we will move on that and do that.
Here's the million-dollar question, and I don't mean to ask you to take out your crystal ball here, but at what point in the vaccination process will we know if herd immunity has begun? Because everybody is asking that big question, when will life return to normal? Will it ever go back to normal?
You know, I believe it will, but that's a great question because I hope it would get people enthusiastic about getting vaccinated. We don't know exactly what the percentage is, but you can do some estimates that I think are reasonably accurate, that between 70 and maybe 85% of the country, if you get that many people vaccinated, you will have what we call an umbrella or a blanket of herd immunity over our society here in the United States, so that you can feel reasonably comfortable that this virus would not be a real threat that it is right now. But we're not going to get there unless people get vaccinated.
Right.
So if you have vaccine hesitancy and people don't want to get vaccinated, then it will take quite a long time to get to that veil of protection that we refer to as herd immunity. So if you want to get back to normal, if you want to have the country and New York City back the way it is that we were used to, then people need to get vaccinated.
Dr. Fauci, we're entering the lightning round. You ready?
Got it.
You've been named President-elect Joe Biden's chief medical advisor. One word to describe how you feel about the new administration.
You know, I feel good. There's a lot of enthusiasm in the administration about attacking this right from the top down, for the leadership of the country being very much involved in getting this under control.
One regret about the handling of COVID-19.
You know, that's tough. I mean, there's always going back in the retrospectoscope and figuring it out. You know, I believe that if we had had a more coordinated approach, but I'm not sure that's anybody's fault. We're living in a very divisive society. I mean, anybody that looks at what's going on in the United States right now is going to be shaking their head and say, oh my goodness, what a divisive society. And when you have a divisive society, then all of a sudden public health matters become politicized. When they become politicized, you got a problem. If someone does not want to wear a mask because they think it's a political statement, that's a problem.
And on the local level, you're a New Yorker. You said earlier this week, and this brought a smile to my face, that theaters could reopen this fall with little to no restrictions. Are we on track for that?
Well, it gets back to the question you asked me a moment ago. If we can get up to 85% of the population vaccinated and really get herd immunity, then I think in the fall we could start approaching some degree of normality. And that would include getting people into theaters. It may not be everybody crowded next to each other. You might have some reduced capacity, but I think we could start talking about getting people back into the entertainment business if, in fact, we get the overwhelming majority of people vaccinated. Music
to many's ear. And on the very local level, this might be the toughest question of all. What do you miss more? New York pizza, New York bagel?
Nathan's hot dogs.
Ah, Nathan's hot dog from Coney Island.
Right.
There you go. Dr. Anthony Fauci, appreciate your time and your expertise as always. You are welcome back here on the Pick 7 News in New York anytime, my friend.
Thank you for having me.
Thank you, Doctor.